The Watts Health Center was one of the very first community health centers funded in the country. And Dr. Robert Tranquada was assigned this project. Prior to the establishment of that center, people who didn't have insurance, which were most of the people living in Watts, had to go to the public hospital that's known as Big County Hospital here in Los Angeles, which was quite often a 12-hour bus ride from Watts because it's in Boyle Heights. Health services were just really not accessible in that community. If someone offered somebody an opportunity to go into Watts at that point in time, the time of the riots and so forth, to say, okay, you're going to start a community-based healthcare program, you're going to have to organize to get doctors in, you're going to have to put together a program, you're going to have to get a facility and so forth. That looked like an incredibly daunting task at that point in time. And despite all of that, Dr. Tranquada and some of his colleagues put a program together that has sustained itself for over 40 years.
The most obvious examples of the difference Bob's made is the proliferation of community clinics throughout Los Angeles County. There are more community clinics in Los Angeles County than in any other county in the country.
In Los Angeles, whether you're talking about managed care, whether you're talking about community clinics, whether you're talking about medical schools, in all of those spheres, Dr. Tranquada has really provided leadership.
I can tell you that I'm aware of 5 or 6 different organizations he started. I have watched many organizations that when they get in trouble, somebody says to them, well, you ought to go talk to Tranquada and see whether or not he can help. So the question about number of organizations he started may be surpassed by the number that he may have saved.
Dr. Tranquada was one of the founders of Community Health Councils, one of the first board members, and has been with us all of these years. I think of him as the person who really gave breath and life to what we do.
And I think in founding CHC and getting it started, he realized that there are communities around California and in Los Angeles that need a voice.
He has been our champion. He has supported us and lifted us up. He has guided us through a very difficult evolution in terms of our understanding of how do you bring about change.
Well, what we learned in medical school and in our medical training was pretty much that, you know, doctors are on top, and anybody who seeks your help or advice should listen to you. We were not taught to listen to the community, and I think if there's one huge lesson I've learned, that would be it, that we individually and collectively really need to pay more attention to the community in which we work.
He has a commitment deep down in his heart and his soul to essentially the improvement of health services for the underserved, okay? And so I think that he's a person that exudes dedication and commitment, and I think that that is something that's really felt when you're in his presence or when you dealt with him.
I believe that we have the professional capability. I believe we have the structural capability. I believe we have all of the elements that it would take to move the United States from its 22nd position in healthcare in the developed world to close to the top, and for some fraction of the cost that we're now spending on our broken system. What we need is the will to work together to have that happen.